Welcome back, everybody. It's Monday morning. This is a Toolbox segment on bloodborne pathogens. The last two Toolbox segments we have been talking about medical emergencies. In this one we're going to discuss part of a medical emergency, but what you can encounter. When you're dealing with a medical emergency, a lot of times you're dealing with bodily fluids and blood. Bloodborne pathogens are microorganisms in the blood that cause disease. You come in contact with somebody's blood, you have to treat it like it's infected. If your mucous membranes are infected with their fluids, you become infected as well. And right now, in the last couple of years, last 10 years, HIV virus and the hepatitis B virus have been on the uprise. When you run into a scenario or you're rendering first aid and there's bodily fluids or blood present, the first thing you want to do is protect yourself. Your health is priority. Your safety is priority. So if you're going to perform CPR or you're just bandaging a laceration, a small wound, and there's blood, you have to treat it like it's infected. You always want to wear protective gloves, no matter what. If you don't have a set of gloves, there's really no improvisations. You need to have a set of nitrile gloves. In our first aid kits, both of them, there are nitrile gloves and there are resuscitation devices, barrier devices. So if you're performing CPR and this person was a traumatic injury, they have blood on their face, you don't want to perform mouth to mouth. You always want to use some type of resuscitation device when performing CPR. If you are the individual rendering first aid and you do come in contact with these bodily fluids, you need to report them immediately to your supervisor. There are steps and protocol that we have to follow in order to ensure that you have not become infected. Immediately wash the exposed area with warm water and soap. If you have contaminated fluids on the floor, you want to use a bleach and warm water mixture to clean that up. And when you do clean up bodily fluids, you don't just throw that stuff in the trash can. You have to have a biohazard bag to put this stuff in. Because remember, some of the viruses are dead as soon as they come in contact with air. HIV is one of those. HIV, as soon as it's exposed to air, it dies. But the hepatitis B virus lives up to 1 week in dried blood. So you always want to protect yourself when dealing with bodily fluids.